Hello learners, today we will be continuing with the previous class. Previous class we discussed regarding the diseases of nose, and today regarding the diseases of pharynx and larynx. So it will be like MCQ pattern only, nothing in detail. We will focus on the MCQ aspect of these part. So first let us start with the most common condition associated with pharynx, that is tonsillitis. So in case of tonsillitis, mainly in case of acute tonsillitis, the most common organism is group A beta hemolytic streptococcus. Beta hemolytic streptococcus. So this is the causative organism, and here it is most commonly seen in children, and clinically there will be fever, sore throat, foul breath, smell will be very bad, then dysphagia, problem in swallowing, rhinophagia, there will be painful swallowing. So this is related to tonsillitis, most common organism, group A beta hemolytic streptococcus, and most common in children, and the clinical features were fever, sore throat, foul breath, dysphagia and rhinophagia. So the next condition is peritonsillar abscess. So peritonsillar abscess is also called as quinsy. And here what happens? There will be pus collection. So whenever the abscess comes, it is none other than pus collection, as you all know. So here the pus collection occurs mainly between the fibrous capsule of tonsil and superior constrictor muscle of pharynx. So here pus collection between the fibrous capsule of tonsil and superior constrictor muscle of pharynx. So here how the presentation will be, there will be severe throat pain, and there will be fever, there will be drooling, there will be foul breath, trismus and altered voice quality. Voice quality will be bad. So this voice quality is also called as hard potato voice. So regarding peritonsillar abscess, which is also called as quinsy, there will be pus collection between the fibrous capsule of tonsil and superior constrictor muscle of pharynx, and there will be severe throat pain, fever, drooling, foul breath, trismus and altered voice quality, that is hard potato voice. So these are the MCQs related to peritonsillar abscess. Then comes Vincent's angina. So by looking at the name, we may think that there is some angina type of symptoms. So here it is not like that. This terminology is called as misnomer. So we should not go by the name. The name is given wrongly. So Vincent's angina is a misnomer, and it is also called as trench mouth. there will be ulcer in the tonsil or soft palate. And it is mainly caused due to fusiform bacillus and spirochetes. So don't go with the name. Vincent angina is a trench mouth which affects the tonsil and soft palate, leading to the ulceration, and is mainly because of fusiform bacillus and spirochetes. Then regarding infectious mononucleosis. So here it is caused by Epstein-Barr virus. Already we have read that Epstein-Barr virus is the causation of nasopharyngeal carcinoma. So next, it mainly spread through droplet infection. So here mainly what occurs? Here there will be pharyngotonsillitis. Pharyngotonsillitis with plaque over the tonsil. So then, and this can be identified with the help of a test, which is also an MCQ one, that is monospot or Paul Bunnell test. So here infectious mononucleosis, the causative organism is Epstein-Barr virus, which is also a causation of nasopharyngeal carcinoma. It mainly spreads through droplet infection, and here there is pharyngotonsillitis. There will be plaque over the tonsil, and on test there is monospot or Paul Bunnell test, which can be useful for detecting this infectious mononucleosis. So this is related to the diseases of pharynx. So let us move ahead with the MCQs related to diseases of larynx. So first condition is laryngomalacia. So here the MCQ points are: first one, this is the most common congenital anomaly of larynx, and then this is the most common cause of congenital laryngeal stridor in infants and children. So stridor will occur if stridor is occurring in infants and children. This is because of laryngomalacia, and it is commonly associated with GERD, gastroesophageal reflux disease. So in case of laryngomalacia, the most common is congenital anomaly of larynx, and most common here it is a causation of congenital laryngeal stridor in infants and children, and it is associated with GERD. Then comes tracheomalacia. So here in case of tracheomalacia, sometimes it may be congenital or it may be associated with tracheoesophageal fistula. And here the most interesting thing is, in case of tracheomalacia, we have a specific cough which is called as barking cough. Okay. So these are the MCQ points related to tracheomalacia. Then laryngocele. So with the name you can identify there is some dilatation. So in case of laryngocele there is dilatation of laryngeal saccule. There will be dilatation of laryngeal saccule, and here comes a sign, that is dry sign. So here there will be gurgling sound. In case of laryngocele there will be gurgling sound if we are pressing the external laryngocele. So here in case of laryngocele there will be dilatation of laryngeal saccule, and the sign which you have to know is dry sign. 1 minute. Sorry, we will continue with the class. And here in case of laryngocele we should know regarding dry sign. So here what happens, there will be gurgling sound while we are pressing the external larynx. Then comes vocal nodule. So here we can see nodules in the vocal cord, which is also called as singer nodes. So this is most commonly seen in females who are actors, who use voice more often. And here it is bilateral, and there will be hard nodules at the junction of anterior third and middle third. So in case of vocal nodules, which is also called as singer node, that will be bilateral, and hard nodule at the junction of anterior third and middle third. Okay. So now moving forward, the next condition is Reinke's edema. So this is mainly seen in middle-aged women, and here what happens, it is mainly because of smoking and voice abuse will lead to this Reinke's edema. And then here what happens, there will be polypoidal degeneration of vocal cords. Polypoidal degeneration of vocal cords. So most common, middle-aged women and castrations, smoking and voice abuse, and there will be polypoidal degeneration of vocal cords, which we can see in Reinke's edema. And MCQs associated with TB larynx. Most commonly affected site is interarytenoid fold, and earliest symptom, weakness of voice, and first sign, impairment of adduction. Okay. So earliest sign is impairment of voice, and first sign is impairment of adduction. And here if we are seeing through laryngoscopy, there will be turban epiglottitis. Turban epiglottitis. and this is none other than pseudoedema. Pseudoedema of epiglottis. So here in case of TB larynx, most common site is interretinite fold and earliest symptom weakness of eyes, and first sign is impairment of adduction, and in case of laryngoscopy we can see turban epiglottitis, which is also called as pseudoedema of epiglottitis. And this is the last condition which we will be discussing with this larynx, that is carcinoma of larynx. And here the most common type is squamous cell carcinoma, and most common type here in particularly is glottic type, that is glottic cancer. And here in case of glottic cancer, as I had already told, this is the most common type of cancer. Yes, it is okay. And hoarseness is the most common symptom. Most common symptom is hoarseness, and it is having best prognosis and radio sensitive. So these are the important points associated with carcinoma of larynx. So almost we had done with this ENT part, and if you have any doubt kindly communicate, and thank you so much.